Welcome to this weekly COVID-19 update. My name is Dr. Agnes Mahomva, the Chief Coordinator for the National Response to COVID-19 pandemic here in Zimbabwe. Thank you, Mr. Nobel Mawunga, on the Sign Language Desk. As of Thursday, 3 December 2020, Zimbabwe had recorded over 10,200 confirmed COVID-19 cases, over 8,600 recoveries, 277 deaths, and a case fatality rate of 2.7%. The highest number of cases has been confirmed in Harare Metropolitan Province, followed by Bulawayo Metropolitan Province. Local, what we call community transmission, remains the main source of infection. Last week, I reported on COVID-19 outbreaks at some of our learning institutions following the reopening of our schools. Outbreak investigations in the affected schools, including contact tracing, were conducted. Recommendations that include the need to strengthen adherence to standard operating procedures and guidelines are being implemented. In addition, Cabinet this week announced that schools will remain open only if they adhere to the COVID-19 standard operating procedures and guidelines. Government, through the Ministry of Primary and Secondary Education, is working with the Ministry of Health and Childcare, the Ministry of Information, Publicity and Broadcasting, and other partners to ensure that the school environment is safe. Measures being taken will also have a positive impact on reducing COVID-19 transmission in the communities, which is the source of infection to our schools. Remember, the main source of infection in Zimbabwe at the moment is community transmission. Last week, I also briefly talked about vaccine development and deployment at both global and local level. Many have since asked me if Zimbabwe is preparing to deploy or roll out experimental vaccines that have not been properly tested for safety. The answer is no. Zimbabwe will only roll out approved COVID-19 vaccines that have been analyzed and found to be effective and safe for use. Government is guided by science when deciding which vaccine Zimbabwe will approve and use. And so we come back in the meantime for us to continuously to remind ourselves to work together and continue adhering to recommended measures because there is no vaccine yet. So in the meantime, let me update you on two processes taking place in preparation for vaccine deployment, rollout, whatever you want to call it. This important aspect of research, which is part of vaccine development, is being led by the National Institute of Health and Research under the Ministry of Health and Childcare. Second, there are the actual rollout preparations, including resource mobilization for approved vaccines that have once again been analyzed and found to be effective and safe for use. On this front, Zimbabwe conducted its first baseline readiness assessment on the 13th of October 2020 using the COVAX facility template. A follow-up assessment was conducted on the 26th of November 2020. Both these assessments had the participation of the National Interagency Coordination Committee, ICC, on immunization, and the Zimbabwe National Immunization Technical Advisory Group. Government led these two assessments and of course roped in participation of various COVID-19 vaccination stakeholders, including the WHO, UNICEF, and others. Results of these assessments have shown that Zimbabwe has made good progress in preparing for the rollout of a safe and approved COVID-19 vaccine. More preparations are, of course, still in progress. These additional preparations include finalization of both internal with Ministry of Finance and external funding applications for the vaccine itself and of course for the actual rollout processes. These preparations are also being informed by experiences and lessons learned from the country's very successful EPI program, i.e. the Expanded Program on Immunization. So once again, in the meantime, before we find a vaccine, before we roll out a vaccine, let us social distance. Wear a face mask that covers both your nose and your mouth. Frequently wash your hands with soap and running water, or frequently sanitize your hands with an alcohol-based sanitizer. 3 weeks ago, I talked about how the country was also preparing to reopen its ports of entry in a phased approach, and that details were to be gazetted soon. Well, these details have just been published in SI 282 of 2020, specifically stating that with effect from 1 December 2020, all ports of entry or ports of exit between Zimbabwe, neighboring countries or territories are now open. That anyone entering Zimbabwe is permitted to do so subject to restrictions outlined in earlier orders, as well as the following additional restrictions. Persons entering Zimbabwe must exhibit a COVID-19 free certificate issued not earlier than the previous 48 hours. Those with no COVID-19 free certificate are refused entry into Zimbabwe, even if they do not have COVID-19 signs and symptoms. Those with COVID-19 symptoms are refused entry into Zimbabwe, even if they have COVID-19 free certificates. Curfew period has also been extended and is now from 2200 hours every day to 0600 hours the following day. Let us remember that lockdown orders are revised, reviewed and amended from time to time in line with how the pandemic is evolving on the ground, and in order to keep the right balance between health and the economic needs of the population. Note, however, that the primary goal of these orders and other public health and social measures is to help curb the spread of COVID-19. Individuals and communities are therefore, once again, I will not hesitate to continue saying this, we're urging you to continue to adhere to all the orders and other recommended social measures, preventative measures. Wear your mask. Ensure it covers both the nose and the mouth. Social distance at least 1 to 2 meters apart. Frequently wash your hands with soap and running water, or frequently sanitize your hands with an alcohol-based sanitizer. Finally, let me take this opportunity to thank all our healthcare workers and other frontline workers for their dedication and their hard work. Thank you, and please stay safe. Do, of course, for all of us, tune in to ZBC, the radio, and other media platforms for this weekly update. Until next time, thank you. I hope.